So as I present, I'll try to make sure that by the end of the session, our memories for COVID turn from negative to positive. That's my vision for this presentation. So as we talk about COVID, or we talk about the Spanish flu, one of the things we get to realize is that, like the rest of the world, we saw a trauma. We saw a realization where more than 500 million lives were affected by Spanish flu. And similarly, when we talk about COVID, more than 5.8 million deaths occurred globally. In middle of all of that, so as I mentioned, Spanish flu had a big impact. Similarly, COVID had a bigger impact. We're talking about 5.8 million lives being affected through COVID. We talk about Pakistan and we realize there are two problems, not one, but two problems. First problem is the problem of saving lives. The second problem is saving livelihood. So we're talking about twofold challenge that we have to take care when we're talking about Pakistan. Add to that complexity when you talk about countries that have 200 million plus population. Pakistan had one of the lowest GDP per capita, along with one of the smallest healthcare budget per GDP. So we're talking about being limited by resources or what we could or what we have done. With all of that in mind, when I started looking at how we would design the COVID strategy for Pakistan, first thing first, we realized we have to learn from data globally. So in Pakistan, we analyzed more than 100 countries at any given point in time, learning from their red flags, learning from their issues, all the way from their best practices to understanding what they're doing. At the same time, there was a gloomy picture going on. There were scientists telling us from across the world that Pakistan has a fear of having many deaths at any given point in time. Some researchers were actually claiming 80,000 deaths per day. So we realized whatever we had to do in Pakistan has to be done within Pakistan. With that strategy in mind, we started analyzing 100 plus global countries, real-time environment for over 600 plus days, learning from their mistakes, making sure that we understand what they're doing right and what we can do learning from their issues. Not only that, we also used the data that we got to build scenarios in Pakistan. So whether we are to close schools, whether we have to initiate people going out in public again, every single strategy that Pakistan took had one or another scenario or a best practice strategy that we had learned from the rest of the world and hyper-localized it for Pakistan. So stage one, we learned from the data. Stage two, building a predictive model to understand where will the disease grow next. When we talk about building a predictive model, we're talking about published research going back to 1927 that how epidemiologists used to learn and build models to predict disease spread. Now this approach was good enough, but it had its own limitations. Limitations in terms of how it understood the disease, how it looked at the disease being spread. So we in Pakistan took a very unique approach. Rather than building it like epidemiologists, we started looking at COVID spread as how wildfires would spread in a jungle, without any direction, without any specific flow. This approach by itself is called stochastic automata technique. So this technique allowed us to monitor a lot many variables that otherwise can be monitored and analyzed. So in Pakistan, rather than just looking at 3 variables, we were looking at a whole lot of variables, from looking at how people travel, to people being unemployed, to retail structure, to infrastructure. Everything was being analyzed. We analyzed more than 15 billion data points on Pakistan. And this data allowed us to do our predictions with an overall accuracy of 97%, 30 days in advance. June, once we realized that we could predict COVID in advance and take care of our critical supplies, ICU beds, ventilators, we went public and told the world that Pakistan had its own COVID model. And the best way to tell that is, a tweet was made by the chairman in COC on that day. And on that specific day, Pakistan had the lowest of the lowest COVID numbers, all-time low. We told the world we are predicting another COVID wave in the next 2 to 4 weeks. This news was picked up by international media like anything. They had all their eyes on us. But as Pakistan was prepared, yes, our prediction came true. Yes, the COVID happened. But we were not only able to predict it, we were prepared in advance, hence ensuring that we save lives and livelihood. Stage 3. Other than looking at the macro side of the COVID, it was equally important that we look at SOP compliance, mask adherence, social distancing. Not an easy job to do. So we came up with a strategy. We'll use computer vision and artificial intelligence to analyze how people were looking at these compliance strategies. We had street cameras as well as citizen support, where people could actually look at the compliance being followed or not being followed in their communities and simply share videos with us. And those videos were analyzed day in, day out, charts prepared, and DC level reports were prepared so that local governments could take action. This is one of the videos for your reference only. So citizens reporting, just simply taking a video, and through artificial intelligence, we could mark out in a specific area, specific street, who was wearing a mask, who was not wearing a mask. Next video, please. Automatically looking at social distancing as well. So by malls, by streets, everything in Pakistan was driven by data. Hence, the reports that were prepared as well took targeted action as we progressed through and throughout the country. So every street that was closed down, every area that had a lockdown, rather than the entire country being in a lockdown, was backed by data and analytics. Stage 4, last part. As COVID increased, there were new variants coming into the country. That is where we realized that the impact of super spreaders can actually affect the growth Pakistan was seeing. So through graph network analysis and use of artificial intelligence, we were able to identify not only COVID patients, but which COVID patients had the potency of being super spreaders. So again, we were able to track, trace, and quarantine and lock down specific streets within a city rather than impacting the entire city or the country. This strategy, combined with everything else that we were doing, allowed us to take an overall approach for Pakistan, which we're calling, looking at this slide again that I presented at the very start. Lowest GDP per capita budget, one of the lowest healthcare budgets for countries that have 200 million plus population. Now let's look at the next slide. With countries more than 200 million plus population, with US having more than 1.2 million deaths, India having 500,000 deaths, Pakistan had recorded deaths less than 31,000. So all those sleepless nights that we used to think about for more than 650 days of the work that we were doing started making a lot of sense for us. And these deaths that you see in Pakistan were primarily people who were 80 plus or had other complexities. So we were able to make sure that our population stays healthy and does not see the mortality rate that was being seen by the rest of the world. So other than lives, we talked about livelihood. One of the best booming economies during COVID was Pakistan. The impact on GDP was none less, more or less, not there in Pakistan. Looking at our countryside, you can see that we were right there to Australia in terms of our GDP doing well. All these analyses, all these reports that we prepared started showing us ground results. So over 2 years, what we saw next was, where rest of the world was closing down, Pakistan had the highest exports in textile in 2021. The Economist ranked Pakistan #1 in the world on the Global Normalcy Index. And the same scientists, the same people across the world who were looking at Pakistan with a lot of doubt started acknowledging Pakistan at all forums. So whether it's the US, the World Health Organization, Bill Gates, everybody was pleased to see and applauded the way Pakistan and Pakistanis took COVID reaction and took COVID into account. With all that said and done, when I look at COVID as a data scientist, I realized that this was probably one of the biggest dreams come true for me to serve my country and impact more than 200 million lives in Pakistan through artificial intelligence. Thank you.